I'm Michael Savitt. I'm a board-certified cardiothoracic surgeon. I did my undergraduate training at Duke University. I'm fellowship trained. I did my general surgery at the University of California, San Francisco, my fellowship at the University of Minnesota. I've been practicing since medical school now about 35 years. I've been actually practicing as a cardiothoracic surgeon for now 24 years. I decided to become a physician. My father is a general surgeon. We grew up and practiced in Milwaukee, Wisconsin. I'm one of three boys. I was the only one actually not originally going into medicine. I was an engineer originally, and I love the way things work and how things put together, and especially all sorts of mechanical and engineering type things. I was a graduate school in biomedical engineering at Duke University and helped a research lab do some cardiac physiology, and I developed a passion for physiology and decided to go to medical school at that time. My philosophy on medicine is I've really enjoyed how things work. That's why I am a cardiac surgeon. I like working with my hands. I like fixing things and building them, but my greatest passion really has come from being able to take that skill set almost as an engineer and applying it to people. No two cases that I do are ever the same. That's unique in what we do in medicine. And the pure joy of getting to know people, what their background is, how they function and why they've gotten there, and helping them has been the passion of mine really over the last years of my career, more so than when I first started. As a cardiothoracic surgeon, we predominantly treat coronary artery disease, which are the blockages of people here from a heart attack. That's the number one procedure we do in the heart. But we also do valvular procedures where we fix them, and I'm actually have expertise, and one of the areas that I have passion in is treating heart failure. So the heart doesn't function particularly well, and we figure out ways to improve that or improve your quality of life while you live and advance with heart failure. Also, as a cardiothoracic, thoracic means the chest, we manage everything in the chest, which predominantly is lung issues, and the number one thing we treat is lung cancer and infections and processes in the lung. In cardiac surgery, the treatments that we've provided as a surgeon have predominantly been open procedures. However, over the last really 2 decades or so, we've had advancement in less invasive procedures, which would be the advent of robotic surgery. We apply that somewhat to the heart. I used to when I was younger. I don't do as much of that to the heart anymore. We do most of it as it applies to the lung and lung surgery. The advances in lung surgery with minimally invasive approaches have really changed the profession over time and changed what we see. And patients that we can operate on with pretty severe lung disease, we can get them through the procedure with less pain, less suffering, and with good outcomes. As far as cardiac surgery goes, while we do have less invasive procedures we can do, the advances really have been on the cardiologist. The cardiologist treats the disease, diagnoses it, and we do surgery. But now we work as a team with cardiology to offer approaches that we can do through the groin, really less invasive procedures for the valves. So the number one advance we've seen in the last couple of years is something called TAVR, or transaortic valve replacement. I'm a valve expert, had expertise in valvular surgery, and now we're doing more and more of that without open surgery. And that's one of the areas that has driven me to come here and really try to grow the heart failure and the other methods, the less invasive methods of providing valvular surgery with my cardiology colleagues. Yeah, I think the most important thing to know is my passion for the specialty. I love to operate, but the greatest joy that I have is really seeing very, very sick people come in, they're scared. It's hard to go through surgery, and to really see a good outcome and participate in the patient's care has given me the most joy. I would say, when you started, you're very focused on your discipline and getting good at it. As I've grown in my profession, that's been what really keeps me going. It's a very hard profession to participate in. It's demanding. We work long hours, but the amount of joy and the grateful aspect you get really can't even be measured. So I am relocating to Texas for the first time. I'm actually a Midwesterner, so I have a little fear about the heat, but I love the area. I look forward to the practice here. It's offered me some opportunities. I have an old associate and partner that I'm going to be working with, and I can't be more excited to have a practice here in South Texas, partly because of the diffuse nature of the different cultural and socioeconomic groups that we'll be taking care of. That gives me actually more self-pleasure to be able to help a lot of people and expand what I do. I've been in an area of lower population and more urban healthcare that I've enjoyed greatly, but larger city with larger population I think will give me more opportunities to impact a larger range of people, and I'm very excited to be practicing here in Texas.